Hi everyone, welcome back to another episode of Medical Care Redefined. Of course, we have Dr. Nguyen with me today. I am excited about this topic. It's about telemedicine and urgent care services in the DPC world. So funny story, I network obviously a lot and I get to do 60-second pitches about DPC and what we do. And one day I was talking about how we're truly 24/7 access and someone pointed at me and was like, dude, do you guys not have a life? You guys must not, because how are you truly 24/7? But I think that we're very equipped in the way that we've trained our team to truly answer patient calls 24/7 so that they don't have to, go to an urgent care or emergency room, right, Dr. Nguyen?
Mm-hmm. Yeah, so like the way that our service is that whenever they text us, we give a patient an answer right away. So majority of the time, they don't have to wait until it's really urgent to call us late at night. Most of our patients very respectful. We try to take care of the patient whenever they need it. So it's very rare that we have somebody that's at 2 o'clock in the morning call us. It does happen because, things does occur, and somebody who's going to have a fever or throwing up in the middle of the night or having chest pain or whatnot can occur at 2 o'clock in the morning. And those calls does go through. And usually most of the time, if it's a patient's call at 2 o'clock in the morning, or whenever it is, I can hear it, I try to answer right away because I know it is urgent, because my patient don't just call me in the middle of the night just to get a medication refill or set an appointment. So
Right, yeah, and I think we have talked about this before, and we put it in our newsletter, you really want to be your hotline for your patients, and I love that, because you never know when something comes up. If you're feeling anxious and you just need someone to talk to, I really love that you really want to vouch for that for your patients and have them call you, right?
Right.
Because otherwise, where else would they go?
Yeah. So I am very prideful about my patient calling me and not, or calling our team and not going to the ER right away, because there's a lot of things, right? We not only take care of them physically, but also mentally. So, in our world of today, we have a lot of mental health issues. And sometimes that phone call, not just the hotline of calling to any, random person of suicidal hotline, but the hotline of calling your own doctor who knows you, who knows your history, and being able to kind of talk my patient through when they're having a suicidal episode or thoughts of plan or anything like that. Being able to kind of help them at that moment is really critical, because that is still an emergency. Yes. Even though we think, oh, they're not they're bleeding out, but that is an emergency because somebody could take their life at that time. So being able to be there for our patient is really valuable. And I really enjoy that because I am in that partnership with my patient. And I literally tell them, call me when you need me.
Yeah.
Even if it's after hours, you have thought of hurting yourself, call me, because I want to be the one who's there for you to help you walk through this.
Yes.
Not only that, but also physical stuff, right? I have a patient that called me at 11:30 at night the other day, and I was in a bed with my daughter, and I was like, my daughter just who's calling you? And I was like, my patient's calling me, I need help with patient. But anyway, my patient was having a lot of stomach pain and he could not lay down and sleep. And so I was able to talk him through it. He had some home medicine that I was able to tell him to take to settle. And so it was kind of easing his mind, because he was afraid that could he be having something that's even worse, that he needs to go to the hospital. But I was able to talk through and recommend some things that saved him an ER visit, and it was in the bedroom with my daughter next to me.
Yes, and I pride ourselves in being so accessible. I could be out and about and still be able to be okay, I'm going to talk to my patients, and patients are understanding. Hey, I'm so sorry. I just need 10 minutes to get to my computer to send something for you if you need it, and they're very understanding. It's not anything, especially if it's not an emergency. But Dr. Nguyen and I started this practice 5 years ago, and we had a team of 3, and so the 3 of us rotated being on call. So Dr. Nguyen was actually on call every day for 3 years, and even last year, I think you were on an international mission trip. I think you're in the plane or even in another country sending prescriptions, because that's just kind of the way that you practice the medicine, and I love that. I think you've also, or you may have touched base with teledoc before. Can you kind of shine a light on what's the difference between teledoc and what we provide as truly telemedicine?
Yeah. So prior to NDPC, I did do teledoc. So it's a service that people can call and ask about stuff. But the thing is, it was not very personable. I don't even know the patient's history, and I'm just kind of sending them something, if they have a UTI, I send them that. But definitely no talking about depression or the history or anything like that, because there was just no time. It was a 5-minute visit, and then after that, okay, bye, and so it doesn't have that personable, and sometimes the patient will get over-treated when they don't really need to.
Yeah.
So for example, if they got sick last week and they already got antibiotics, and you get on teledoc again, they're going to give you another course of antibiotic without even looking at okay, what was given to him before, before? Did they respond to it? What else is like? So it's not very personable, and the quality of care is not very good. And then you also increase risk of resistance and then being overtreated or undertreated.
I think also there's like a virtual waiting room. So every time you have to pay a fee, you sit in this room, then you talk to like an MA maybe or a nurse, and then the doctor. And then like you said, like if you forgot to mention a problem, you have to like go back into this waiting room, see another provider who doesn't even know. I didn't even know they didn't even document like the history of like, all of that.
So actually you only get to ask one thing at a time. So like each time you log in, you only have like one items that you could treat it with. You don't actually get to like, oh, I want to talk about my depression and my, UTI. So it has to be like a separate visit. And so it's very complicated versus like, with us, we literally take care of everything. Like even when they do come, we can take care of their whole list of things.
Yes, and you already have their medication list. You already know what they're allergic to. I think also it's very unique and neat. We work with a lot of bigger companies who want to provide like diabetes prevention, and you can even do that virtually. Like we have patients in Houston and Oklahoma. Walk us through that. Like how does that work for patients who aren't like able to come in physically to see you for things like that?
So we do a lot of like telemedicine. So we do video visits. So what I usually will do is like I initiate with them and kind of see what is it that they're wanting. So if they're wanting to weight loss or like kind of overall improve their health, they could still check the blood pressure at home, send me the stuff through Spruce, and then I go through it with them. I still go through my 7 rules of weight loss. They'll talk about nutrition, still talk about exercise, still my same self, just I can't examine them. But we could go through all of that and then still recommend, the medications, and I can send prescription for them if need be, and then still follow up with them every month, just kind of checking in. Are they losing weight? How are they doing overall? So we do a lot of that, and a patient is still very successful with the weight loss, even virtually, because we're able to really kind of give that personal visit versus like on a virtual, like for weight loss, a lot of people are getting semaglutide and tirzepatide online, right? They don't really have that personal connection where the doctor or the provider is talking to them about nutrition. It's just, here's a prescription, and then they give the shot, and what happens is that they lose muscles and they lose fat. Nobody's talking about like how can they maintain their muscle. Even though virtually we're still doing that, but we're really educating the patient on lifestyle change along with the diet. So it is very different than how some of the online companies does it.
I love that you mentioned that, because I think also when you go onto the online services, they're just sending you the same dose like for 12 months, and I'm like, how is that possible? Because I've seen you like work with the patient, adjust and kind of go up a little bit but then down a little bit, right? Like it's just harder to do those kind of things when you're just getting sent a prescription without like getting
right
care.
And then sometimes they have side effects, so then you have to adjust the dosing. And the thing is, if they're on that dose and they're not losing weight, if we already maxed on the dose, what else can we add in, right? So it's kind of that personalization for that particular patient, because it's not just like about losing the weight. What else are there? Like what other supplements do we want to recommend to prevent muscle loss and other things?
Yeah, I think also too with our direct primary care, like even though we are primary care, I think adding the telemedicine services help enhance the membership a lot more, right? Today I had a call of somebody who's like, hey, my husband is a truck driver. Like he's obviously not home a lot, but he needs a physical done. What can you do for him other than that? And I'm like, well, if he's traveling, he needs something, like we're a call away. Even every month we can still check in with him. So I think that I think we provide so much more value just having the telemedicine services. So what else do you think like telemedicine can help enhance DPC in that sense?
So for him, right, like he is on the road, and if he were to like catch a cold or like flu or whatever where he's at, he doesn't like have to go to an urgent care or go check into the hospital. He can just call us. We can screen all the symptoms, like, okay, what symptoms do you have? And then we can call the prescription to the nearest pharmacy that he's at. Literally, he could take the medicine, feel better, and then go on his day. Like he could literally do that. And then we are also very good at like recommending things. So if he's not that sick yet, but he wants to know like what allergy medicine to take, what's the best, like for my runny nose or for my sore throat, what are the best, then we can always recommend that and then even point them to get the proper medicine over the counter. We send pictures all the time. Like that's kind of one of the really nice thing about us, is that we have in this electronic world that we would just send pictures and they would be able to go exactly, oh, I want this, instead of like just trying to look around for it.
Hi, everyone. Thank you so much for tuning into our podcast episode. This is just a friendly reminder that our membership is as low as $85 a month for all your primary, urgent, and emergent care needs, as well as personalized services in weight loss and hormone replacement therapy. Here is a testimony from one of our DPC Health family members.
My name is Amy Smith. I've been a patient since December, specifically Christmas Eve, and probably the best Christmas gift I could have given myself. I actually have been going to doctors since high school and middle school. I have a family history of heart problems. Nobody could figure out what my heart problem was because it wasn't directly to do with my heart. I actually have blood pressure issues, and I was misdiagnosed in high school. My aunt told me it would go away, and it actually became worse over time. I was able to go to the doctor on my own, and I was happily able to find you guys, specifically DPC Health. They have the most wonderful doctor, and I have a daughter now, and so my health kind of deteriorated a lot after having her. She's a hyper kid, and as soon as she could start crawling and walking, I noticed a significant decline in being able to chase after her. So when I came here, I was able to get on medicine, and everything has been incredibly affordable. I can get my medicine here. I can get the test done here. My daughter is almost 2, and now she's running. And so right before I came in, I was kind of bedridden. And now I'm able to run after her at a park without having to worry about anything. I'm able to do everything almost completely normal. My blood pressure was also causing my temperature to drop. So even though it was 90 degrees outside, I was having to wear almost 2 layers sometimes just because of air conditioning. And now I'm able to wear leggings and a sweater and do everything like my sister is, or a stranger on the street is that doesn't have the health issues that I have. And the change is so drastic. I used to wake up and have to stay in bed for about an hour and slowly get up, and that's not something you can do when your toddler's like breakfast immediately and wanting to play after breakfast, and she's super outdoorsy, so even just the temperature change from outside to inside would make me pass out. I couldn't go upstairs, I'd pass out. Standing up would make me pass out, and I don't have any of that now. It's a godsend, literally. I could cry because it's so amazing to be able to feel normal, and this is a place that I would recommend to anybody and everybody. I'm actually moving soon, and I'm willing to drive an hour out to come here and to come back. My daughter actually is kind of scared of strangers, but the moment she comes here, she knows the place, she knows where the stickers are at, she looks for the staff to play with them, she knows to pick people somehow, and she knows that the staff here are amazing. I'll be coming here probably the rest of my life. And if it moves places, I'm gonna come, whether it's a 2-hour drive or 3-hour drive, I'm gonna come back.
I think on top of the telemedicine, though, we have to talk about the urgent care piece, because I think they kind of complement each other in the world that, we're running medicine. As far as urgent care services go, I think that a lot of primary care physicians probably don't do as much of the urgent care services that you do, right?
That's true.
Yeah, I think one thing for sure that comes to mind, because I have been prone to like sprain my back every now and then, and you've given me trigger point injections. And when someone I know has like that similar pain and they're not a member, or like I'm trying to help them figure out where to go, I'm like, you should find someone who does trigger point. But they're like, oh, I think that's something you have to get referred to a PT, get examined, and then they might do it. So tell us more about that. Why did you get into like those kind of urgent care services?
Yeah, so a lot of people in primary care, the service when I was at USMD, nobody was doing procedures or injections or anything like that, because it was kind of like in and out, and then they refer patients to everywhere. For me, I train as a physician who wants to take care of my patient as a whole, kind of like talking about like going back to the old world, like where you're the doctor that take care of everything. But I always kind of talk about we're also modern. We're always kind of updated with new things, like with peptides and all this other stuff. So we're kind of like that old and new school kind of thing, where as I want to be able to take care of my patients, because I feel like I know them, I feel more comfortable treating them, instead of having to refer to somebody that I don't really know or trust. So in this case, like, patients, like the other day, I had a patient. He was on his way to work, but his back was hurting so bad. He sprained it. And he's like, "Oh my gosh, doc, my back hurts so much. I can't. I need to go to work, but I can't. What can you do to help me right away?" Yes, generally we can give them muscle relaxant and anti-inflammatory, but muscle relaxant sometimes makes them sleepy. And so if he needs to work, he can't take the muscle relaxant like while he's flying or driving, right? And so what I did was have him come in, do some trigger point injection, his pain relieved right away. The next day I got a message, "Dr. Nguyen, that shot works amazingly well. I went to work and had no issue at all." So things like that was able to kind of really, really help patients. So I enjoy that.
Yeah, and I think that it's cool because yes, it does wonders. So trigger point injections, I think that's cool that you do. Even migraine management, you do a lot of casting and splinting, like things that are just like out of the norm for a primary care physician. You provide that service for our patients.
Yeah, so like that's the other thing is like migraine treatment, right? A lot of doctors generally just prescribe pills, and sometimes the pills help, but then when they get into that really intense headache that nothing is breaking it, occipital blocks is something that I was very blessed to be able to train by a headache specialist at Scott and White when I was in residency. So I've been able to do that for a long time. But anyway, it's just simple lidocaine, just like numbing the nerve to break that headache, and it instantly remove it, where patients like sometimes before they've seen me, sometimes they like have been down for days, closed in a dark room and like sleeping and can't get anything done. But now my patient knows when they have a bad headache, they come find Dr. Nguyen, break that headache, and then they can go back to work pretty easily. And so my patients no longer suffer like before they've seen me, they didn't know, but now they do. It's an easy treatment, but it breaks the headache really, really well without any side effects, really.
Yes, yeah. So, I mean, obviously with urgent care services during the week, Monday through Friday when we're open, like if you're really sick or you need an urgent care service, like we try to get you in the same day. You're like, "Hey, I'm on my way." And we're like, "Okay, we're going to squeeze you and we're going to see you," because we don't want our patients to go without us. Now, let's say someone calls us after hours on the weekends, Dr. Nguyen, like how do you handle that kind of urgent or emergency care need?
So a lot of the times, like if it's something that we can handle over the phone, I go ahead and take care of it and like send a medication in or consult them depending on what they need. But there's certain things that I have to come in to meet the patient here. So for example, I think a few weeks ago, we had a child, he's 11, I think, and he was helping his dad do the dishes. And I guess he was washing knives or something, got a big cut on his hand, and mom freaked out and like sent me a picture. And I was like on my way home from church, and I was like, "Oh, that's a pretty deep laceration." So I just met them at, so I said, "Hey, I'm gonna drop off my kid, meet me at the office." I sewed him up and he was good to go. The thing was, the difference was about that is they technically could go to an urgent care, right? Or a care now or whatever. But that child felt a lot more comfortable to come to see me because I've been his doctor, like, doing his physical, and he knows me. So he didn't feel as scared when he came to see me as like not just another physician like poking him, because this is his first laceration. He was really nervous, but the fact that he already knew me as a physician, and then like I was very gentle with him, and so it was easy peasy. Like we got out of here in like 10 minutes after I sew him up real quick, and then that's it. The other day when he came back for the suture removal, he was like, "Oh my gosh," he was so grateful that we were able to sew him up on the weekend. Mom even made us cookies.
That's awesome. Is our laceration repair something other PCP doctors do, or is it just a you thing?
Not generally. So
Yeah.
primary care doctors usually don't do that. They
Yeah.
just send the patient to the urgent care or care or ER or something like that, but on a regular setting. Most primary care doctors don't do laceration repair just because especially in a fee for service, they're too busy.
Yeah.
And so it's like too much time to be able to like get off. And also like it's usually managed by like a system, and so like they don't like carry lidocaine and all that little
that's
like
true.
instruments and stuff like that for the provider anyway, even if they want to do it. So it's not just the provider, but it's also the system doesn't want them to do
And then
that.
I'm sure billing and stuff like that too, the insurance role, like there's just a lot
Yeah,
behind that.
so in like a big system, for example, THR or whatever, they want them to send it to their urgent care because they can bill more.
Yeah.
Like they can charge the patient more.
Yeah.
So therefore, they don't want their primary care doctor to do it. Unfortunately, it's kind of a game.
Just the way the
It's about-
insurance work. But even if you didn't have insurance, I think like to have an emergency with a regular fee for service role, like if you go to the urgent care, you're paying like whatever
Like
out of pocket
$1,000.
to see them, and then the procedure and the medication costs. Whereas like in a DPC world, which I hope all the other doctors do it too, you can just come and like have your doctor take care of it, and they already know you.
Yeah.
So even after hours on the weekends. So
Yeah,
I mean.
and it's included in your membership.
I guess, like, what do you think about the fact that we're doing all the urgent care and emergency care stuff? How is that helping patients, like, or how is that clearing the void and the strain of, like, ERs in general, like the visits and, like, the cluster of all the patients that need to go to an ER? How are we helping prevent that?
Yeah. So, sometimes patients don't necessarily need to go to the ER, right? So the ER should be reserved for people who are like having a heart attack or, the bone sticking out or something like that. Sometimes the ER just gets so busy and all the truly urgent stuff gets delayed is because they're there for things that are not necessary, like the flu or like a laceration that a primary care should technically be able to do, because all family medicine should be trained to be able to do laceration repair, but we're cutting a lot of that back, and so therefore the ER and urgent care are like being packed with things that are not necessary there. And then also costs increased, right? So yeah, I think that being able to do that at a DPC model, it really cut back costs overall for healthcare.
Before we listen to our next patient testimony, we just want to remind you that DPC Health is available for small businesses too. As a small business owner, you can contribute as much or as little as you want towards your membership for your employees. We also provide mobile services so we can come on site to your workplace whenever you need us to. Let us be your medical team and doctor at DPC Health, where medical care is redefined.
My name is Landon Shaw. I've been here for about two years. I came here initially to kind of get my hormones checked, and my wife is the one who found the clinic, and it just became one of those kind of obvious things after first stepping in here, to have somebody that's going to listen to you and kind of hear your concerns and then work with you all along the way of this journey of trying to get your body right, makes you feel so much more comfortable in your skin, really. But then you also have the other side. It's not just, for me, the hormone deal. I get ear infections every year, and they are brutal. And this last year, I had an ear infection for 3 weeks, and every single week, Christina was on the phone with me. She was helping me get my prescriptions. She was changing my antibiotics whenever I needed it, and she just wanted to make sure that I was okay. It didn't feel like I was just going in to see a doctor that's like, here's some medication, good luck. And it's, and I've gotten really comfortable with the front of pharmacy here. So he knows my name as soon as I come in, and we get to chat a little bit, and it's less a medical experience and more just kind of, going to a place that's familiar.
And then I don't think we've touched much base on this. I know that you do casting and splinting, but like, is putting a bone back in place a normal PCP thing either?
So let me take that back. So I actually had a kid. So I wouldn't put a bone, like if it's fractured, like all fractures sticking out, I can't put it back.
Right.
But if it is a displacement. So I had a child that was like
recently.
Yeah, recently. It was after hour. She was like 2 years old. Yeah. And dad was just playing with the child, and by all means just means well, accidentally like pulled the elbow out of place, and she was crying, and they were freaking out. They didn't know what to do. So they called us after hours, and I was like, "Oh, come on in." So I actually just put the elbow back in place, which was easy peasy. It looked like 30 seconds, then the child was able to hold up the arm. So it was also very rewarding for me. I was like doing those things, not I feel bad that it was hurting, but it was kind of rewarding for me to be able to put that back where the parents didn't have to spend like thousands of dollars in the ER, and then they don't have to feel distressed. Like it's done, and so it was kind of cool to be able to do things like
and
that.
being able to use your skill sets, like that's why you're a doctor, right?
I love it.
So I have a funny story again to tell. Recently I was on call with you, I think it was last week, and I was leaving your house from dinner. It was pouring rain. A patient had texted like, "Hey, I can't come in tomorrow. I got tested positive for the flu." So I was like, "Are you okay?" hey, like, you know, do you need medicine, whatever. He's like, you know, like an hour later, he's like, I should have texted you. I went to an urgent care and they locked me in. So our patient sent me a screenshot of him being on the news because it says Keller man locked in urgent care. And he's just like, I should not have gone here. And I joked and I was like, yeah, if you ever go to DPCL, we won't forget about you. But do you have any fun last story to tell about like an urgent care or telemedicine, you know, need that you've taken care of a patient for?
You know, I think it was probably when there was a little girl that, I think she was like 3 years old or something like that. She was, I guess, playing, and then mom said she ran into a wall.
Oh.
Like she just kind of smushed in like that, and then she got a big old laceration in her ears. And so when she came in, I was like, oh my gosh, they sent pictures like, this girl's gonna cry. I'm gonna be so nervous when I sew up her. Like she's gonna, like, I do have a little soft heart when I see little girls crying or kids crying, but I was so nervous coming in. I was like, okay, I'm gonna meet him in the office. I'm gonna sew her up, but then I'm so afraid she's gonna cry and then I can't finish up my work, right? But anyway, I came in and she was like very calm, and she was just sitting still, letting me do it, and I was like, oh my gosh. But anyway, at the end, she did give me a big old hug, and it was awesome. So
yes.
Anyway, that story was really kind of heartwarming for me too.
Yeah, I love that. I love all the hard work that you do. So thank you for everything you provide to our patients. So yeah, I think it's super cool, super amazing that a provider like you is able to do all of the extra things, especially in the DPC practice, to provide that additional care. So appreciate it.
And I enjoy it. It is something I'm very passionate about. I want to be able to be there for my patient, whether it is, you know, all the time if I can. Of course, we still have a life. So I am also very grateful for our patient who's very understanding, right? They don't call us like at midnight. They only call us when they need to. So we really appreciate our patient for like, you know, that valuing our time also.
Yeah, and the moral of the story here is don't go to urgent care, you get locked in. So, so thanks for tuning in to this episode. We're at DPC Health, where medical care is redefined.